Okay, so we've discussed the different descriptors and the individualized experience of the pain of cancer pain. Isn't that still just one treatment fits all? I'm in pain. I go to my healthcare professional and I say I'm in pain, and they still give me the one treatment, which is my pain medication, pharmaceutical intervention. Um, Surely this is just an easily managed side effect of cancer.
Pain is what the patient says it is. It is a unique and individualized experience. And so when you say, well, I'm going to the doctor and I must just get medication and one size fits all is not accurate at all, because you need to understand what the cause of the pain is. You need to understand what that experience by the patient is at that point in time, and to realize that there's more than one treatment option, most certainly. We're talking at the moment about a physical pain. We haven't even considered the total pain. And total pain is massively important and often under-recognized because, yes, I can have a physical pain that is caused by damage or injury to my organs, to my tissues, or to my nerves. But what about that excruciating pain caused by my emotions? Because I'm frightened. Because I'm frightened of dying. I'm frightened of losing control. I'm frightened of being alone. I'm frightened of being ostracized from my community. I'm frightened that I might be contagious and that my cancer I might take it home with me to my children and give my children cancer, which we know is wrong. We know that's impossible. But certainly there are myths that still exist in our communities today. So we have to consider total pain, which includes a physical aspect, physical pain, which we've described. There's a massive component of emotional pain as well, which includes fear and anxiety. And very often my patients have described the emotional pain as being torture. That's the one that is far worse than anything else. Because certainly the physical pain, very often, there is some medical treatment for it. There is some pill or medicine that you can take that will make the pain go to sleep for a while, as it was described to me once before. It will alleviate the pain. It will hopefully even make the pain go away. But those medications don't do anything for my emotional pain, the pain of my soul, the pain of my thoughts, the pain of my emotions. And then if we're talking total pain, we include not just emotions, but what about the psychosocial aspects? The psychosocial aspects of being diagnosed with cancer, being ostracized from your community, perhaps losing your role in that community. Things have changed. Your role in that society has altered. That can bring about pain.
Or even closer to home with your spouse or your kids, or family, parents.
Perhaps you're no longer able to be the breadwinner. So that leads us to a different type of pain again, and that's financial pain. I need to take time off work because I need to have my cancer treatments. But during that time, I can't earn money and I might be the breadwinner. Or I'm taking excessive time off work and now my job is under threat. And then, of course, just trying to afford the treatments brings about a massive amount of pain. Now, my physical pain is causing a financial pain because I cannot afford to purchase the pain medications needed.
So, Rowan, what are some of the barriers that an individual or a patient would experience in their time in trying to manage their pain through their journey?
I think one of the biggest factors is inadequate knowledge, just not knowing enough about pain, your own experience of pain, realizing that it is complicated, that there's so many factors that come into play. So perhaps you think of pain as being the physical experience, the pain that I'm having in my knee at the moment, but perhaps not taking into account that today that experience of pain might be heightened because the dog died. There's another emotional factor that has made my experience be felt more acutely, more severely than normal. So it's understanding your cancer pain is often a massive barrier to your own care.
With that in mind, is it then important to make sure that you're tracking your pain in between your appointments with your treating party? Because when they say, how are you feeling today, you might be in a good space on that specific day, but you're not managing your cancer pain through the 2 week prior.
I know, again, communication is key. And so many of our videos have referred back to the importance of communication and being able to describe your pain as you've experienced it to your treating team, not just at that moment, but over the last couple of weeks since you last saw them or couple of days since you last saw them. Being able to say to them that these are the various types of pain that I'm experiencing. This is how severely I'm experiencing them. So you can actually measure them. And it's a simple thing. On a pain scale of 0 to 10, 0 being I have no pain whatsoever, 10 being the worst pain that you can imagine. Let's say that the pain in my knee right at this moment is a 4 out of 10, but yesterday it was a 6 out of 10 or a 3 out of 10, etc. So you're tracking it over time, remembering that there's not just one pain, there might be several pains in different places, and you might describe each of those pains using different words. So again, the example, the pain in my knee is throbbing. The pain in my stomach is tingling or burning. The emotional pain that I'm experiencing is I'm feeling so lonely today. I'm overwhelmed with loneliness today. My support structures are not there today. All of this information is massively helpful to a treating team so that together you are able to manage this really terrible symptom of cancer pain.
So the more information and knowledge that you can give your treating team about the holistic pain that you're experiencing, the better they would be able to help you manage it.
Most definitely. Another barrier to care is the failure to report. So just as we've spoken about the importance of sharing this information, communicating this information, certainly a very real barrier that we experience as healthcare professionals is the patients not reporting their pain for whatever reason. Perhaps they don't want to distract the treating team. It's so important that my doctor focuses on treating my cancer. I don't want to talk about my pain. Let's just get the cancer sorted out. So that becomes a second and a third barrier. I'm not reporting my pain adequately. I'm not describing it properly. I'm not giving enough information, perhaps because the third reason, I don't want to distract the treating team. We try and stoically manage our own pain, whereas an alternative and far more preferred option would be to actually communicate this pain to the treating team so that they can assist.
Would it be fair to say that if an individual, maybe in that specific example, was expecting pain with cancer, they wouldn't report it because it was something that they just thought they had to deal with, and that is a potential barrier, as opposed to, we don't want you to feel pain, so you must report it because it is manageable?
Unfortunately, the reality is that many people believe that because they are living with cancer, because they've been diagnosed with cancer, pain is a consequence of that. Pain is something that you're going to have to live with. You have cancer, you must have pain. So that's not always true. It doesn't have to be like that. So by just, again, not communicating, keeping it all to yourself, trying to stoically manage your pain on your own is really not in your best interests. Whereas just by simply communicating with others, allowing people to help you, helping people to help you by communicating effectively can make the big difference between an improved quality of life or really suffering in silence with your cancer pain.
And I think that's important for all the aspects of pain, not just the physical, but the emotional. An emotional aspect of pain. If you're carrying an incredibly heavy weight, which is the pain of cancer, it's easier having other people help you carry that load by sharing that information with them.
I had a set of conversations with a number of patients quite recently, asking them, what do I need to know about their pain? How can I assist them in their pain experience, in hopefully improving that? And in different ways, the response was, my physical pain you will treat with a medicine of sorts. And that medicine will improve my experience of pain. It possibly will make my pain go to sleep for a while, and it might even make my pain go away. My next question was, well, how does the pain medicine help with your emotional pain, with the pain of your thoughts, with the pain of your emotions, with the pain of your soul? And they said, the medicines don't do anything for that. But what you're doing at the moment by listening, that's the difference. There is a belief out there that pain medication is addictive, and rightly so. In many instances, pain medication is abused in our society. But within the realm of cancer pain, which is the topic of conversation today, so many of our patients don't want to take their pain medications because they're frightened of becoming addicted. And so therefore, they're not taking the pain medicine as they should, and therefore, their pain is not coming under control. One of the other barriers to effective pain management is poor adherence. So in other words, not taking your medication as prescribed. Many reasons for this. Our previous point was being frightened of addiction. So I'm not taking the pain medicine as prescribed because I'm frightened to become addicted to it. I'm not taking the pain medication as prescribed because I'm frightened of the side effects of the pain medication. And we know that most pain medication, for example, causes constipation. And I'm really worried about constipation, so therefore I'm not taking my pain treatments and my pain is not under control.
Could those two also then be the opposite way around? For example, if I'm on a pain medication that maybe isn't managing my symptoms as well as they should be, I then start taking them more often to try and manage the pain, and that would lead into potentially becoming more addicted, as opposed to identifying it early, going back to your earlier points about communicating it with my doctor and saying, Doc, this isn't managing the pain that I'm experiencing. Are we able to change into something alternate treatment path?
I'm going to slightly change direction over there if we can, because there are so many different pain medications that can be prescribed by a doctor based on what he is hearing from you. So according to what you've told the doctor, he or she may prescribe a pain medication which is appropriate for pain at a certain level. But if the doctor's not getting the full story and not fully understanding how bad that experience actually is, the doctor may prescribe a milder pain medicine as opposed to a stronger type of medicine. So if you're keeping silent because you're worried about addiction or because you just don't like taking tablets, some people just don't like taking tablets. And so perhaps underreporting your symptoms may lead to a prescription of a milder type of medication, which might not be ideal for you.
Might not manage your pain.
Might not manage your pain at all, in fact. The last barrier to effective pain management is a financial barrier. Just not being able to afford that medication.
It is expensive.
It is expensive, although not all pain medications are expensive. Some of them are actually relatively affordable. But so often we find the situation where a patient will store their medication. They will wait until that pain is really unbearable because they know they've only got a limited supply of medications, of funds. And that is heartbreaking. It really is. Whereas there are cheaper alternatives that are very, very effective. And morphine is one of those examples. There is a time where morphine is an appropriate medication to take for pain. And we're immediately frightened because morphine is considered to be the death drug, which it's not. It's definitely often thought of as being addictive, which it is not. And it is a relatively cheap, inexpensive, and easy to administer medication that can certainly bring cancer pain under control effectively if taken as prescribed for the right reasons. Thanks for tuning in and watching our video. If you have any questions, comments, or even suggestions on what you'd like to see in future content, please leave them in the comment section below, and we'll get back to you as soon as we can. We're here to support you in your journey to learn more about cancer and how to manage it. Join our community and empower yourself with knowledge and resources to make informed decisions about your health.